his presentation is comparison of corneal topographic measurements and high order aberration in keratoconus.
Good afternoon, ladies and gentlemen. Myself, Sandeep Kandel, B. Optometry final year student from Institute of Medicine. Today, I'm going to talk on the topic comparison of corneal topographic measurements and high order aberrations in keratoconus. Now, let's begin with introduction. Keratoconus, as we all know, is a slowly progressive non-inflammatory corneal disorder characterized by anterior corneal protrusion and thinning of central stroma. As shown in the figure, there is anterior corneal protrusion and the thinning of central stroma, which is characteristics of keratoconus. And high order aberrations, topographic images can be obtained in multiple planes and location of anterior segment in eyes via new SIMFLOG imaging technique for the diagnosis of keratoconus. Continuing with introduction, as the disease progresses, patient experience increased blurring and distortion of vision due to high order aberration. Here, in the picture, we can show the retinal image simulation of keratoconus patients due to high order aberration, where we can see ghosting of image as well. So, some investigators have used high order aberrations to distinguish early keratoconus from normal, and others have used them to grade the severity of keratoconus. Now, coming on to the objective of study. The objective was to compare the corneal topographic measurements and anterior corneal high order corneal aberrations and determine the utility of anterior corneal high order aberrations in diagnosis of keratoconus using bone series corneal topography. Now, coming on to materials and methodology. This study is a descriptive cross-sectional hospital-based study which was done among the patients diagnosed with keratoconus at EOD clinic of BPKLCS. This study included 54 eyes of 27 keratoconus patients as the subjects. Now, the inclusion criteria was the subjects diagnosed with keratoconus in the EOD clinic of BPKLCS between the age of 10 to 34 years. And the exclusion criteria was patients with glaucoma, corneal pathologies, cataracts, dry eyes, retinal and choroidal pathology, and past ophthalmic surgery, including refractive surgeries. The study tool was bone series corneal topography. It is a combined corneal topographer as well as the aberrometer, which combines both technologies, including Placidot imaging, which provides curvature data, and SIMFLOG imaging, which is optimal for precise elevation data. It can also extrapolate corneal wavefront data from analysis of anterior and posterior corneal surfaces using mathematical analysis of height data. These are the images of corneal topography taken from the bone series corneal topographer. This is the image of corneal topography of keratoconus patient. Here we can see in this first picture there is corneal thinning, as well as in second picture there is tangential anterior curvature is markedly steeper than a normal cornea. This is the corneal wavefront analysis of bone series corneal topography. Here we can see the retinal image simulation of keratoconus patient, where we can see the pretty much distortion in the retinal image. And here we can see the predominant vertical coma in the second picture, which is the main high order aberration that affects the keratoconus patients. Now, coming on to the study group. The keratoconus cases were graded as keratoconus suspect and keratoconus compatible in the first stage. Then they were further classified. The keratoconus compatible group was further categorized into 4 stages based on Amsler-Crumey criteria, namely stage 1st, 2nd, 3rd, and 4th. Now let's discuss results. Among the 54 cases, 70% cases were male and 29% cases were female. And the main age group of my study was 20.55, with minimum age being 11 and maximum 34. Here we can see the staging of keratoconus. In keratoconus suspect group, we had 14.8% patients, while 37 in stage 1st, 33 in stage 2nd, 7.4 each in stage 3rd and stage 4th. Now let's discuss the corneal topography indices of keratoconus patients based on the staging. Where we can see key average, average, and central corneal thickness of the keratoconus patient were significantly changed according to the severity of disease, and these data were statistically significant based on Kruskal-Wallis test. Continuing with corneal topography indices, asymmetry index in front surface, back surface, BCV index of front surface, back surface, and total BCV index were found to significantly increase with the severity of disease, and these data were significant based on Kruskal-Wallis test. And coming on to the aberrometry analysis, the total wavefront aberration, high order aberration, point spread function, coma, trifold, and spherical aberration were found to significantly increase with the progression of disease. And among them also, high order aberration, coma, and spherical aberration were found to be significant, even more significant with the progression of disease. And these were also statistically significant based on Kruskal-Wallis test. Here we can see the graph of progressive increase of high order aberration in keratoconus based on the staging of disease. Here we can see from keratoconus suspect to stage 4 keratoconus, there is significant increase in high order aberrations in keratoconus patient, which is the main factor for degradation of vision. Now let's come to discussion. Simplog imaging method has been an important diagnostic tool method for diagnosis of keratoconus disease. High order ocular aberration, which cannot be corrected with common spherocylindrical glasses, can also have important impact on retinal image quality in subjects. This is the high order aberration that we can normally find. This is the Zernix pyramid, where we can see the vertical. Is there a pointer? Can we go back? Here we can see the vertical coma in the 4th row and the spherical aberration in the last row. These are the main high order aberration that have impact on keratoconus patient's vision. Comparison of corneal high order aberration in normal eyes and eyes with keratoconus showed coma-like and spherical-like aberration were significantly higher in keratoconus group, and coma, which occurs when the apex of cornea fails to align with other optical elements. As in keratoconus disease, with the increase in severity, the inferior stiffening of corneal surface causes apex of cornea to decenter, resulting in significantly increased amount of coma-related aberrations. All aberrations were significantly increased in keratoconus patient except trefoil, vertical, and horizontal tetrafoil aberrations. There was significantly high correlation between abnormal corneal curvature and total aberration, therefore determining high order aberration as beneficial in diagnosis of keratoconus. In our study, there was significant increase in corneal topographic indices, including K average, mm average, central corneal thickness, symmetry index of front surface, as well as other corneal topography indices, and high order aberration, including high order aberration, mean high order aberration, total wavefront aberration, coma, trefoil, and spherical aberration were also found to increase with the progression of disease. And all these values were found to be statistically significant. It has been reported that there is significant increase in ocular aberrations with age, so especially with onset of presbyopia. Hence, only the patients under age 35 were included in our study to minimize the impact of age. The limitations that can be concluded in 2 points. The evaluation of high order aberration was only done in the anterior corneal surface, because anterior corneal surface being the major corneal refractive element of the eye, because of significant difference between the refractive index of air and anterior corneal surface. And evaluation of high order aberration was done in only one pupil size, that was 4.5 mm in our study. Now coming on to conclusions. The anterior high order aberrations along with low order aberration were found to have major impact and visual degradation found in keratoconus. Corneal aberrometry along with corneal topography, classical corneal topography indices can be useful in the diagnosis of and classification of keratoconus. The new spectacles based on adaptive optics, rigid contact lenses, intraocular lenses, and wavefront guided corneal refractive surgeries can be efficient ways in managing high order aberrations. Thank you so much. Last but not the least, I would like to take a moment to thank Nepalese Association of Optometrists for providing such a great opportunity for me to present in such a grand event. Thank you.
Thank you, Sandeep. We will take up the question at the end of the session. Now I would like to invite Mr. Manish Subedi. The topic of his presentation is clinical relationship of mebography with ocular symptoms and tear film stability in meibomian gland dysfunction.
Good afternoon, ladies and gentlemen. Myself Manish Subedi, final year B optometry student at Institute of Medicine. My presentation topic is clinical relationship of mebography with ocular symptoms and tear film stability in meibomian gland dysfunction. Beginning with introduction, mammalian dysfunction is a chronic diffuse abnormality of the mammalian gland which is generally characterized by